Hi, how are you? Before we will start this day's episode, this is a daily reminder that it's okay to feel. Your feelings are valid. It's okay to cry. Just take your time. It's okay to be different. And it's okay to not be okay. Anyway, welcome back to the Nursing Show. For today's episode, we will have a virtual trip to the mental hospital. But before that, did you know that we have a mother of psychiatric nursing? If you want to know her, just sit back and listen.
To the hospital.
So we are already here in a mental institution. I had learned that there are at least 3.6 million Filipinos battling under mental health issues in the year 2021. I have also here a video of the bibliography of the mother of psychiatric nursing. So what are we waiting for? Let us watch now.
Hildegard Elizabeth Peplau was born on September 1, 1909 in Reading, Pennsylvania, USA. At young age, Hildegard has already the urge to go beyond traditional women's duties. In year 1918, she witnessed the flu epidemic in which had a big impact on her knowledge on illness and death. In 1931, she graduated in Pottstown, Pennsylvania School in Nursing. In 1946, she worked with the British and American psychiatry to restructure the mental health system in United System with the enactment of National Mental Health Act. She met this psychiatrist while she was stationed in the Field Station Hospital. In early 1960s at Teachers College, she created and conducted the first classes for graduate psychiatric nursing students. In the year 1952, Peplau published Interpersonal Relations in Nursing. In 1975 to 1976, she helped establish Europe's first graduate nursing program in University of Leuven in Belgium. Hildegard Peplau died in March 17, 1999.
Hildegard Peplau is the mother of psychiatric nursing. The field of psychiatric nursing was formed due to her theoretical and clinical work. Aside from being the founder of modern psychiatric nursing, she is also an innovative educator and an advocate for the mentally ill. Nursing theory is called interpersonal relationship in nursing practice. It emphasized the importance of a nurse-client relationship. It stressed that many nursing problems can be overcome through strong interrelation since it helps the client understand their mental issues. It has four phases, which are orientation, identification, exploitation, and resolution. In each phase, the client performs certain tasks which is facilitated by the nurse. But before I will discuss that one by one, we will watch a video that applies the four phases in psychiatric nursing. This phase begins as the nurse meets the client and ends when the client starts to identify the problems that needs to be examined. The nurse establishes the role, build rapport, and ask relevant questions for assessment. As a nurse, it is also important to listen closely to clients' experiences and perception without judgment.
Good afternoon, my name is Astrid and I'll be your psychiatric nurse for the next 4 weeks. You're gonna be meeting for a talk like this. Can you look at me? For 45 minutes every Monday to Wednesday at 8 a.m. So, what would you like me to address you with? What name should I call you?
Just call me Frieza.
Frieza, okay Frieza. So, how are you this afternoon, Frieza?
I'm feeling great than yesterday.
Than yesterday?
Yes.
Okay. Why? What happened yesterday?
I saw a balloon and someone gave me a balloon and treat me for breakfast.
Okay. So I just want to ask Frieza, for our talks like this that will be happening for the next 4 weeks, what do you expect out of it? What do you want to happen?
I expect that we will be okay and our problems will be solved. And I hope that this conversation will be fruitful.
Okay. So I am just here to support you in your goals towards your health treatment, Frieza, okay?
Thank
second phase is identification. During this phase, since rapport is already built, the client can now express their feelings. He or she also starts to identify the issues or concerns that causing the problem. As a nurse, we must always remember that it must be the client who will identify their problem. They must be the one who will analyze their issues.
Okay, Frieza, is there anything bothering you right now? I can see like you're fidgeting and you're uncomfy. Can you tell me about it?
Yes. When I was a child, my father was killed in front of me. I was alone that time, and I saw the face of the killer. I felt afraid that time.
What else has that made you feel?
I always feel unsafe. I'm paranoid, and
I think somebody is watching you. I understand that with what happened, you now feel safe and paranoid about it, and your feelings are really valid because of what happened. So what is like something that's really a problem that's bothering you right now, that's keeping you from doing everyday life things? Do you have problem eating or problem communicating with people or making friends? Anything like that?
nowadays I can't sleep, and I'm afraid because I think that the killer would find me and will kill me.
Oh, okay, I understand. Yes, your fear is really valid because of what happened. So, how many hours of sleep do you get at night? Do you really get zero, or how many hours?
I think I can sleep 2 hours.
Only 2 hours. Okay,
Yes.
yes, that is really a problem, and maybe we can work on developing some skills so that you can sleep better at night. Would that be fine?
Yes,
Okay, that would be one of our goals then.
yes, thank you so much for your help.
The third phase is exploitation. As the client analyzes their issues, what we can do is to support them like giving therapeutic touch. We must also refrain from giving advices, or whenever they ask for our opinion, we must redirect them. During this phase, the nurse facilitates and guides the client in assessing their feelings, develop and practice good coping skills, and encourage behavior improvement.
Hello, Frieza. How are you today?
Hello, ma'am. I feel sad and I feel afraid.
Oh, so can you scale it like from 1 to 10, 10 being the saddest or depressed, and 1 is the calm or happy? Can you scale it?
I scale it to 9.
Okay, so whenever you feel sad, what are the things that you do in order to relieve your sadness?
When I am sad, I just lock my door and hide under my blanket.
Why should you try doing breathing exercise? You take deep breaths, you count whenever you're breathing. You can do it in order to relieve your stress or the sadness you're experiencing. Aside from doing breathing exercise, you can also divert your attention, like you watch movies. So what are your favorite movies?
I like watching SpongeBob SquarePants.
Oh, so that's good. You can also do that in order to change your mood from sadness into happiness. So that are the things that will help you, especially in coping with your stress or your what you are experiencing. So one is to take deep breath, do breathing exercise, and then you can also like watch movies. So that's all for today, Krisa. Thank you very much for listening.
Thank you so much, ma'am, for giving me an advice.
The last phase is a resolution phase, which is also the hardest phase. In this phase, the problem is resolved and the nurse-client relationship is ended. The services in this phase are no longer needed by the patient, and this is called the hardest phase since there are patients who do not participate in the last phase since they do not want the relationship to end.
Hello again, Krisa. How are you today?
Hi, ma'am. I feel better now.
Oh, that's good. I'm really happy to see you like that. Your progress is really getting better. I can also see in your face that you are very happy. So the coping strategies that we've discussed, like the breathing exercise, the deep breathing, and like the other um, things that relieves your stress, like watching movies really help you, right?
Yes, ma'am.
So that's good to know. So um, aside from that, do you have other things or problems that you want to bring up or you want to share?
I don't have any problems now, ma'am.
Okay, that's good. You're really getting better, and I'm so happy for that. Just remember that whenever you feel down, just believe in yourself and just work on yourself. That always think that you can do it. So think always for the positive side, and that will really help you. So I'm very thankful that you don't have any problems right now. There is nothing bothering you. That's good to hear, Teresa. You really did a great job.
Thank you so much, ma'am, for helping me.
Aside from the phases in the nurse-client relationship, did you know that there are also different roles played by nurses in the nurse-client interaction? The first role is the stranger. It conveys the same acceptance and civility to the client when the nurse meets another stranger in another situation. The nurse will build an environment that builds trust. The next role is being a resource person. It gives clients a precise or specific answer to their questions to help them understand their problem. The third role is being a teacher. It helps client to learn. The fourth role is being a leader. It helps clients to be responsible in achieving their treatment goals. Did you know that the nurse could also be a surrogate? They could substitute the parent, the sibling, the husband or wife to make decision for the client when the client is unable to make a decision for themselves. And the last role of the nurse is being a counselor. Nurses as counselor will help and encourage the client in understanding the meaning of the current life situations. The 4 levels of anxiety are mild, moderate, severe, and panic. As a nurse, it is important that we are capable of recognizing the signs and symptoms associated with each of the 4 levels in order to formulate an intervention for the anxious client. The next video that we will watch is the application of this theory in psychiatric nursing.
Let us now discuss the application in psychiatric nursing. Psychiatric nursing was established due to the foundation of the nurse-client relationship. This relationship is a connection in which both parties must acknowledge each other as a unique and significant human being. Both parties learn from each other. Patient-centered care is encouraged as vital to quality in today's healthcare setting. It is part of the core of nursing practice concepts that were first proposed last 60 years by Hildegard Peplau. The concepts has been recognized by the medical community is not only relevant but also critical in improving the quality and safety of healthcare in the future. As what Peplau stated in 1991,
So this is the end of today's show. Thank you for watching.